diagnosed with femoral acetabular impingement. That's a diagnosis that has been catching common ground in the past 10 to 20 years, but there's a lot of people that still don't know what it is. So let's take a look. What is femoral acetabular impingement? Femoral acetabular impingement, or FAI, means that the head of your femur isn't perfectly rounded and it might be impinging into the acetabulum. The acetabulum is the structure or the hole in your pelvis where your femoral head sits in. Fun fact, there are two different types of FAI. There's the CAM and there's the pincer. The CAM is much more prevalent in males as it has a sex distribution of 14:1, and it's diagnosed as an aspherical head shape. So instead of that nice perfect head shape, you might notice that it might be a little oval or crooked, or it's just not that perfect femoral head shape that we want. Then there's also the pincer, with a sexual distribution from male to female at 1:3. So it's much more prevalent in actually older females around the age of 50. And what they've noticed with a pincer is that there's a little bit more of a growth on the edge of the acetabulum. So it's actually pinching and catching the femoral head shape. So what can we do about it? Right? So if we have mechanical changes in the hip, how are we going to help you out? So what I've noticed is that first and foremost, it starts with the muscles, as it usually does, at least in my opinion. Whether you have tight hip flexors, you have weak glutes, we need to help address the issue at hand. What I find out that works a lot or very well for these type of clients with either CAM or pincer is to help loosen up the hip flexors. A lot of people have tight hip flexors, so there's definitely a fair amount of stretching or some tissue work that goes on. And a lot of times people have difficulty using their glute max. The glute max is one of the biggest muscles in our body. It tends to be shut down from pain in the hip joint, which I've noticed anecdotally. And then lastly, some joint mobilizations. So once I've kind of loosened up the tissue, we've done some hands-on work, I'm going to literally try to get into that joint and loosen up parts of the joint that you weren't able to access into. I would say a general trend is to help loosen up the posterior side of the hip joint based off the type of mobilizations that I do. For some of my older clientele, some of the anterior parts of their capsule seem to be tight. Arguably, that would help improve your extension or your ability to bring your hip back behind you. So that's a lot of information on FAI, but again, I hope that gets you guys started in the right direction to learn a little bit more about it. Thanks for tuning in.